a new scandal that shows we really need a royal commission into the handling of the coronavirus pandemic that Anthony Albanese promised last year before he became Prime Minister.
It is beyond doubt that you will need an assessment. Whether that be a royal commission or some form of inquiry, that will need to happen.
But now that Albanese and the Labor premiers, well, they're running away from any inquiry. I guess it might be too embarrassing. But we do need it because too many people suffered too much from the bungling and the crazy lockdowns of the politicians. And if we don't learn the lessons, we're going to repeat that same nightmare all over again with the next pandemic. So take this latest news. Health data from Victoria that the government there tried to keep secret shows that more than 600 Victorians died after catching this COVID-19 virus exactly where they should have been safest, in the state's hospitals. You think about that. You had Premier Daniel Andrews locking down millions of Melburnians for months with his ludicrously tough lockdowns. Children were even banned from playing outside, even though healthy children weren't being killed by this virus, and almost no one at all got infected outside. Meanwhile, he ran his own quarantine hotel so badly that the virus repeatedly escaped and killed at least 760-odd people, and his hospitals had such poor infection control that we now have these more than 600 deaths as well. What on earth was Daniel Andrews doing during the pandemic if he couldn't even do these basic things? Joining me is one of Australia's very top infectious diseases experts, Professor Peter Collignon from the Australian National University. Peter Collignon, it's great to catch up with you again. Now, I know that hospitals by definition have a lot of sick people in there, so it's going to be a challenge to stop infections spreading. But more than 600 people dying from catching COVID in Victoria's hospitals, that does sound a little sloppy, doesn't it?
Well, it is a major concern that so many people did die. I might say you've got to put this in context with a lot of other infections people can get in hospitals, MRSA, resistant bugs, even influenza. And one of the basic problems we have is our hospitals need to be better designed. We don't have enough single rooms with their own bathroom facilities. Every hospital we have open should plan on having at least 80% single rooms with own bathroom facilities. If you're in a 4-bedded room and you've got COVID or anything else, the chances you're going to give it to other people in that room are very high. So, there's basic things we need to change, and we've got a long way to go. Most of our hospitals don't have that sort of single bed capacity. And then if you look at emergency departments, how crowded they are, how people are together, there's a lot more we need to do, not only for COVID, but lots of other things.
It seems to me, though, an incredible sort of misuse of the resources we had there. We had governments locking people in their homes, stopping them from going outside where it's perfectly safe, yet at the same time not doing enough, it seems to me, to stop people catching it in the facilities they themselves ran. For example, quarantine hotels and hospitals. Does that strike you too, as that perhaps the focus was completely wrong?
Well, the focus could have been changed a bit more, but there's still a basic infrastructure problem, not only in Victoria, but the rest of the world. But to put it in perspective, you're absolutely right about stopping people going outside. Yes, you can get COVID if you're outside, but the chances are very, very small compared to being inside. And perversely, having rules like you could only go outside for an hour a day and only if you're walking, not sitting on a park bench, that meant people, particularly lower socioeconomic people, were crowded together in apartments, more likely to spread it to each other. And because often they were essential workers like cleaners, delivery drivers, that actually spread it more. So we made, that was a big mistake, I think, stopping people going outside. Lockdowns themselves were never part of any pandemic plan. It was the Chinese that did that first in Wuhan, and then that was copied around the world. But if you look at the available data, for instance, from Sweden, who did follow a pandemic plan, and you look at excess deaths, because whether you die from COVID or delayed surgery, for cancer, at the end of the day, it's the number of people that die over a period of time that's important. And excess deaths overall are no higher in Sweden than in Australia. They're about the same. And if anything, Sweden has done better than most of Europe that had much harsher restrictions. And again, you brought up quarantine hotels. Generally, they were quite successful, I might say, except in Victoria. While there were outbreaks in other states, they were brought under control. And even in New South Wales, most of the problems there were from airline staff rather than guests that were in quarantine hotels. Now, whether we needed them to that extent, you could have done some home quarantine as well, as another issue. But generally, most of the things that governments did around Australia, were moderately or reasonably successful at stopping spread till we got vaccinated. But the real problem was, I think, again, you rightly point out, hospitals and nursing homes where the biggest risk people were, and often there was a lot of spread.
It seems strange to me, those were the places where people were actually dying, particularly aged care homes, and yet we had whole populations forced, including children who almost the healthy children almost never got killed by this virus, and almost no one got infected outside, and the governments were spending so much effort, so much policing on enforcing those stupid restrictions rather than where the hotspots were. Now, looking back then, seeing some of the mistakes, seeing some of the misplaced emphasis, seeing things like, banning even of playgrounds of all things, or surfing, or going to the beach, and the enormous cost of these lockdowns that we're now feeling now, the economic costs. Do you think it is time that we had a royal commission into how we handled this particular pandemic? Because we can't have this happen again.
Well, I do think we need to learn from what we've done right and what we did wrong, and there were lots of both. And that actually means something like a royal commission, but we need to make sure it's not politicised. This has become so political, it's difficult to have an intelligent conversation about, well, this was okay, this wasn't. People seem to have taken themselves into camps and won't discuss it with the other groups. So zero COVID was never a good idea in my view, but that's my view. And I think we need a proper independent inquiry so we learn to do it better in the future. I mean, there are other things out there that can cause pandemics. Bird flu has been a worry for about 20 years and may or may not be a problem. But we need to not punish children, which had the lowest risk of death for everybody compared to older adults. And we did a lot of things that caused a lot of social and economic harm for maybe not that much health benefits when we look over the last 3 years.
And I don't see many politicians admitting they got it wrong. I mean, I can excuse them getting it wrong in a sense. There was a lot we didn't know, but seriously, you warned at the time it was over the top. I thought at the time it was over the top. No one wanted to hear then. We need to hear now. Peter Collignon, thank you so much indeed for your time.
Thank you for having me.